everybody, welcome back to my channel. Thank you so much for joining us. Thank you so much for taking your time off your busy schedules. I know you're quite busy, but I appreciate you guys joining us. And I want to take this time also to thank you for subscribing to the channel. And if you haven't subscribed, what are you waiting for? Alright, so basically, before we get into the channel, I know I promised you guys a video about my journey with depression, but I've had to postpone that till next week because I feel like there's a very urgent and pressing matter that we should talk about, rather, that we should discuss. And that is why my beautiful mother is here to join me today. She's going to be my special guest. She's going to be answering a few questions about a very sensitive topic currently. So, today we're going to be speaking about Covid-19 pandemic. Yes, I know it's been spoken about ever since the breakout, and you know it's been on people's mouths, lips, whatever, ever since. And I know people are quite bored of it, and you know, but I can't help but think, how has this affected us individually? So the reason why my mom is here today, some of you may know, my mom is a frontline worker, particularly a nurse. She's a health worker, and so she's been on the front line ever since the breakout. She's been one of those healthcare workers who have diligently and, you know, I don't know, done this with passion, you know, helped to help our country. And, you know, she's taken her time and she's taken the risk of actually contracting the disease, but she's had to fulfill her duties as well as her other colleagues and many other frontline workers. So basically, I want to ask her a few questions regarding how she and her other colleagues or other frontline workers may have been affected mentally by the pandemic. So Mom, so basically, I just wanted to know, when the pandemic broke out, when you first started working with COVID positive patients, what came into your mind? What was your biggest fear?
Actually, I just don't want to tell lies. It was really scary. And nobody would like to go there to work with the COVID positive patients, because in where I'm working, we have to divide. We have to divide to help the COVID negative patients and the COVID positive patients. So nobody really wanted to go and face those COVID positive patients. One day when I went to work, I didn't know I was going to go there. And when I got there, I was allocated in those COVID positive patients. And I was like, dear God, how am I going to face this? But I just took a big sigh and I said, okay, let me go there. The following day, I said, it's okay, you can allocate me there. I'll face it. I just had the guts. I just prayed my God. I said, God, if that's the way, it's okay. Let me take it, because I have to care for those souls. Because if we don't take care of them, who's going to do? And then it was like, it had a big psychological impact. Even though I didn't notice that my family is noticing me, but I was trying to be hard, to be strong, and I was trying not to show it, but I was like, yo, this thing. But I realized when I saw my daughter's message one time on the WhatsApp status, and I was like, oh God, this thing is affecting my family, but what can I do? But I tried to make them understand, and I tried to make them understand that I was caught up with. The nice thing with my hospital where I'm working, they just gave us from the very same day the PPEs, the proper PPEs, and we just felt more safe. And then we had to discuss it with my other colleagues. We said, guys, let's do it. I think we are more safer that side where there's positive patients more than where there's negative patients. So we just did it.
Guys, for me it sounds really scary because I don't think I would have been able to do it. I don't have that much strength. I feel like healthcare workers have been really sort of like undermined when it comes to the way that they're coping, you know, and dealing with the pandemic itself. It's said that, you know, they've been nurses and they've been healthcare workers for the longest of time. You know, my mom's been doing this for about 35 years. And so when this pandemic broke out, it was kind of like people didn't really worry about them because it's kind of like, oh, you trained to be a nurse, you know, you've done this for such a long time. So it was kind of like nobody bothered to ask them the questions. How are you doing? You know, how was work? How are you coping? You know, those type of sensitive questions that we should be asking, you know. I know there's a lot of us who stay with not just healthcare workers or who are related to them. There's a lot of other frontline duties, your police, your people who work for ShopRite or Checkers, you know, other people have been working ever since the breakout of this pandemic. I feel like they've been undermined, even though there's been like those supportive messages, you know, saying that we see you and we see what you're doing for our country and we salute you. But is that enough? You know, so I want to ask Mom, Uguti, so far with the pandemic, do you feel like you guys have been getting, or do you personally feel that you've been receiving enough support from your family, from your friends, and from the government to be specific?
Truly, from the family, yes. Okay. And from my management, they are trying and they are doing their best, even though there's something lacking. You know, we really need the psychotherapy. This thing is psychologically affecting us. We understand they are also going through the same. Because they are under pressure also. The department is on them. Everything is on them. This thing has just come with a total change, drastic change to everything in the whole world globally. Yeah. So we understand their pressure, but we really would appreciate some kind of psychological support, especially when you are being diagnosed with COVID positive as a worker. The follow-up, just a message, just a phone call to ask you, how are you doing? But we really don't, it's lacking somehow. But anyway, we're trying to support each other, thinking that they are having their pressures and whatever. We just take it like that, you see. But the government, to be honest, even though I'm in the private sector, but the government really, to me, it doesn't really, I didn't see any support except for the president to stand there in front of the TV and say, frontline workers. He's giving money to the people that are not working. That is our taxpayer, the taxpayers' money. But he never had something to say for those people, for those frontline workers. Let me just give a certain support, a certain something that will just at least make them feel a little bit accepted, a little bit appreciated in this thing, you know. He doesn't even think about that. In that sense, I just feel...
I feel like, you know, what makes me angry or what takes me off is that there are other frontline workers who have received danger allowance. But when it comes to health workers, I feel like the government is just not budging. The nurses and doctors even have gone out on strike and, you know, trying to make their voices heard, saying that, you know, we are risking our lives, we're risking the lives of our family members, we're putting ourselves in danger, we're putting ourselves out there, but why are we not being recognized as important, or why are we not being recognized like the other professions who have been given or granted danger allowance? So I really, really understand the frustration, and I understand as well that the psychotherapy part is very, very important, and you know, this thing has affected all of us, and being in the front line means, you know, I have to be strong for myself, I have to be strong for my family, because at the end of the day I have to ensure that my family sleeps with food in their stomachs. You know, they don't
ensure that I don't bring it home to my family.
Can you imagine that amount of stress? You know, every time you leave that ward or the ICU, you trying to make sure that I don't take this home to my kids or to my family. I think that for me brings a bit of anxiety, you know. Like, guys, now I don't want to lie. You know, the past couple of weeks or the past couple of months, like, I've seen what a toll it's taken on my mother. Like, guys, sometimes, like, I'm not gonna lie, sometimes her feet are swollen, like her ankles are not even showing, even currently. Sometimes even maybe twice or 3 times a week, I have to rub her back, I have to give her a massage. Like, guys, it's taken such a toll on her, not just physically but emotionally as well. You know, you can tell when someone is emotionally drained. It's just, but what are we doing about it? You know, what is the government doing to help nurses, healthcare workers? You know, these people are overworked because of shortages at work, staff shortages at work. So they need to work extra hours. They need to, my mom works on her off days, on her leave days. She needs to put in the hours, you know, because there's no staff to support at work. So I feel like it's really just affected her, but it's also affected us as her family. You know, every time she leaves for work, we have to pray, like, God, please, you need to protect my mom. Like, when she comes back in the morning, guys, through. Like, every time I hear her open the door, in the kitchen door, I breathe a heavy sigh, and I'm like, thank you, Lord, for bringing her home safe and for protecting her throughout the night. Because it's not an easy thing to deal with, you know, knowing that your parent is there, or your sibling or your sister, or your father or whoever is dealing with these people, or with this pandemic rather, physically. And it's just, guys, it's not, I feel like we're not having these conversations enough, we're not discussing these things enough. But another thing I wanted to ask you, Mom, is that, you know, when you're in that ward and you're all dressed up in your PPE and you find that they are positive patients, right? And then they become ventilated. Usually you tell us that when you go into a ventilator, that's it. You know, that's almost the last straw, if not, you know. And you look at these people grasp, you know, for their last breath, and they're unable to breathe, and there's nothing that you can do to help when you've done everything else that you could do. Like, what goes through your mind at that time? How does that affect you? How does that affected you? Because I know that in the past, yes, working before the pandemic, you have lost people, you know, lost patients and stuff. But now specifically, there's more losses, or there's been more losses in the past couple of months. How has that affected you? Oh my God.
Yeah. You know, for all my years being a nurse, it's not easy to see somebody dying. Because all our patients, we take them as our relatives or whatever. Whenever I'm nursing somebody there, I think of, like, I'm nursing my mother, I'm nursing my sister, I'm nursing my relatives. I don't take it as a somebody from outside or somebody from that I don't know. And then that makes you have the bond, even bond with the family. With this COVID thing, it's so painful because even the relatives cannot come to see their patients because of the laws. And there's the way we can combat it. There's no other thing that we can do. So now you have to be the family, you have to be everything to them. You understand? And you see them suffering, you see them struggling, you see them psychologically stressed, and all that. You have to take all those punches from them, from the family members when they are calling, from the whatever. You have to try to normalize the situation. It's even worse when somebody, you can see that somebody is losing their life or his life. It's so traumatic, I don't realize. But to be honest with you, we had some cases whereby they walked out of the hospital from the ventilator. That was the worst excitement ever in the whole hospital.
I can imagine, like the whole hospital was just clapping for that patient.
It's like that was our achievement, our greatest achievement. And even now we still have, even though we still have people that we are losing. It's so sad. It's so sad. It's really sad. Sometimes the condition just changes quick, and then you just try to act, and then within hours you lose that person. It's so sad. It's painful.
Yeah, can't be nice, guys. Seeing someone
It's affecting really, and I think we really need some psychotherapy at the second stage.
Yeah,
And
like
it's something like a rest also. We need some rest because now we're just working ourselves out because of the shortage of staff, and the people need to be taken care of. And then what can you do? You just have to go. Sometimes you feel but you see now, if somebody is going to nurse 4 patients alone,
yeah,
then it's too heavy, and then you say, okay, I'll just come and assist. You see, I'll come and help. And then
yeah, but even so, that's like compromising yourself as well, you know. But yeah, guys, I feel like not only has that taken a toll on healthcare workers, not only has it taken a toll on frontline workers, but it's also taken a toll on everyone else, especially the COVID positive patients, that test positive. There's a stigma, guys, around this this COVID-19 thing. There's a stigma. People just don't want anything to do with you. People don't want to bury people who have tested positive, It's just it's appalling, to be honest. It's too much. It's too much for anyone to take. So
sorry to cut you there, but at the end of the day, I'll just ask the community, everyone who's listening to this, let's just accept it as is. The government has taken the rules, just put the rules of any other infectious disease. It's not that it's about they don't love those people or whatever. When people are not allowed to, for example, to view the body of your loved ones, because they normally say this COVID is more active in the dead body. You see, so when you're viewing that person, that body, then you might contract it, you might breathe it, it might come out. It's airborne. It's in contact, which means when you contact somebody, airborne, it means you breathe it in the air. So it comes out from that body. That body is taking out all the secretions by that time because there's no control. So when you're opening that body, it just comes out into the air, so you're going to breathe it. And then if you touch it, there's a contact. And then if I'm talking to you like this, you should be keeping this social distance, understand? Yeah. Because this droplet is also droplet infection. So if I talk with my saliva jumping into you, so you can be, you understand? So that's why we have to keep on putting our masks, we're doing all the precautionary measures, we clean our hands, we do everything. So let's not take it personal. This is just a global thing. This is affected everyone. So if it happens to you, it has happened to me also. I've lost my beloved one, my brother, my cousin, who is my brother I grew up with. I couldn't go to bury him because of these restrictions. And it's still it's painful. I don't have a closure. But one day I will have a closure. It's fine because there's nothing I could do. And I'm in the Western Cape province where everything is just like, and when we go to KZN home and they will say you've just brought this thing, so I just have to abide with the rules.
Yeah, guys, please let's start taking this seriously. I know there's a lot of people, especially Lokshini, especially Futse Makaya, people don't, it's kind of like if it hasn't reached your family yet, you don't believe that or you don't think that it can ever affect you or your family, and so you don't take enough precautionary measures. But guys, this COVID thing is real.
Yes, we do consider the environment also. Yes, we can stay in this room, maybe about 5 of us, because we've got nowhere else to stay. This is the only place we can stay. But please, let's just wear our masks. Let's just try to use this hand sanitizers and everything, and to make sure when we go out there, we just do as we are asked to.
Yeah. Alright, so I think that is it for today. That's the end of our conversation. Mom, thank you so much for joining.
Welcome. Thank you.
Thank you so much for having this conversation with me. Guys, like I said, this is an open conversation, you know. It's not just health workers that are affected by this pandemic, but you also as an individual, it has affected you in some way, you know. I know even the little ones are affected. They miss their friends, they want to go play outside, you know, but we are affected differently as different people. So I want to hear from you. I'd like to hear from you actually. What are your stories? How are you affected? You know, what has this meant, or what has this change brought about? What is yeah, this change. What does it mean to you? And you know, I know a lot of people are anxious about the future. I mean, all of us are. But you know, I think we need to start accepting that life is never going to go back to being the same again.
Yes,
you know, things are not going to go back to prior 2020. Things are just going to be a different life. Our lives as we knew them.
We need to expect that.
Yeah. So I think let's have this conversation, guys. Let's talk about this. Let's talk about how we've been psychologically affected by this. Let's have this conversation. Share your stories with me. Ask any questions. Ask for clarity or anything you want to talk about, anything you want to share. Yeah, we're here. We're here to support you guys. We are here to, you know, talk about the very important things in our lives that we take for granted, and this was just one of them. So thank you guys for joining us, and I'm very sorry for the long video, but it had to be done. Thank you for joining us. Until next time, it's love and light.